So this video is going to outline content from chapter 6, really talking about the importance of trustworthiness and transparency within organizations, within supervision, as trauma-informed leaders, in psychodrama, and in group psychotherapy in general. I want to talk about the second trauma-informed principle, trustworthiness and transparency, as it relates to leadership in group work and psychodrama. So, of course, as group workers, we're in a leadership role. We're leading the group. And we have to cultivate trust in our groups. We have to help clients to trust each other, to trust the process, and to trust us as facilitators. One really simple thing we can do to cultivate trust is to provide a simple outline or an overview of what the plan is for the session. This is something I push myself to do every time I teach and every time I lead a therapy group. I start off, I say, this is what the plan is for today. We're going to do this, then we're going to do that, then we're going to do this, then we're going to do that. Of course, I leave room for group choices and spontaneity within that, and I'll tell the group, at this point, maybe we're going to have a group choice, or the group's going to propose topics and choose a topic. But I clearly outline what the process is going to be and or what the content is going to be in the session. And this simple act of transparency can really help people who might be really hyper aroused or stressed about not knowing what to expect in the session, to really help them ground, to connect with some safety, and to be more trusting throughout the process. So, really simple thing to implement. Research suggests that one of the reasons clients discontinue group therapy directly related to their inability to trust the group or other members in the group. So, trustworthiness is particularly important between group members in a group. Others in the research said that the trusting bond within the group was one of the most important aspects for their safety in the group. So, group therapy research is showing that mistrust in the group decreases as the cohesion in the group increases. So, group cohesion is related to that first trauma-informed principle of safety, but also related to the second trauma-informed principle of trustworthiness. There's an author named John Allen who wrote a book called Trusting in Psychotherapy. And he says, to a great extent, trusting and trustworthiness are relationship specific, and they must be created anew in each relationship, developed, maintained, and repaired when disrupted. The creation is interpersonal. So this is a good reminder of how important trust is for relationships, for connection, and for group psychotherapy. So arousal, hyperarousal, is one of the main symptoms of PTSD, which is likely to make clients more hypersensitive and aware to the actions of the leader and other people in the group. So as leaders, we have to demonstrate that we're trustworthy, and we have to be able to repair ruptures when they occur, ruptures to trust and to the relationship. As a group leader, we also have to learn how to trust the process and to trust the group, to trust ourselves as facilitators, and to trust our training and our clinical instincts. This really requires us to engage in our own personal growth work and our own professional development. Really want to encourage you to pause here and reflect on how exactly are you continuing to engage in your own personal growth work, and how exactly are you continuing to engage in your own professional growth.